You're doing good. Okay, so now let's talk about your next letter. Yesterday we talked about the the previous letter, and I can see there's a clear difference between yesterday's letter and today's letter. But definitely there is always a room to improve, and we do have to improve in order to pass this test. Okay. So the salutations are okay. There's no problem with here. Smithtown Department of Thoracic Medicine. Okay, that's okay. Date is fine. I would recommend leaving one empty line after after Smithtown. Okay, what you can do, you can leave this line empty and then you can write the date here, and then again you can spare one line. Okay, and then you can write dear Dr. Stark, and then one spare line, and then you can write RE with James Smith date of birth, and it's better to add comma over here. Okay, so that's much better way of writing the salutations. Okay. Then I'm writing to refer James, who was admitted with signs and symptoms suggestive of pleural effusion and pneumonia. He need your assessment regularly. Okay, regarding lung transplant suitability or exploratory surgery. Okay, the first thing is he needs. It's not need. It should be needs. And I would say there was not mentioned that he had pleural effusion and pneumonia. You could, if you read the case note, it was written that recurrent respiratory tract infections are there. This is the word they have mentioned. So it is not about making a diagnosis in this sort of, exam in OET. You don't need to make the diagnosis out of the case notes. Whatever is given inside the case notes, use that information, probability and probable things are use the similar words, and it's completely okay to use those words and the information and mention that. So what you can write here is, I'm writing to refer James, who was admitted with recurrent respiratory tract infections. Your further assessment and management, including a double lung transplant suitability, would be highly appreciated. And this letter, if you see here, you are going to discharge the patient and refer the patient. So there are three ways to write this letter. The first one is either write refer plus discharge, okay, or the other best way is to simply write a transfer letter. Okay, I'm writing to transfer because you are sending the patient from one department to another. So you can mention it in a transfer way. That would be more better. Okay, but if you need to write it in a way like the referral or discharge, then do mention. Okay, so what you can, the much better purpose would be what? I'm writing to refer James, who was admitted with recurrent respiratory tract infections. He, or the other ways, I'm writing to refer James, who has treated for recurrent respiratory tract infection. He's now ready to be discharged, okay, into your care for further assessment and management, including a double lung transplant suitability. This is the best purpose that you can write in this sort of letter. This one is okay. Okay, you will still be able to, manage to pass it down, but definitely you are not writing the discharge in the purpose. So then, you're on the borderline. But if you write the other way, then the chances are bright. Okay. Then move forward. He was admitted on the state with complaints of severe. Please follow and be very careful with the spelling, okay? Difficulty in breathing, hypoxia, and coughing up blood. He also complained fever. Okay, so what you can write here is, rather than writing also complained fever, okay, he also had fever, headache, and facial pain. Okay, that is the better way to write it down. Okay, rather than this. Then if we move forward, On examination, he had increased respiratory rate. Again, please be very careful with the spellings. I can't understand whether it is rated, okay, or it's rate, okay, or rattle, okay, it could be anything. So if you'll put examiner in this situation, he has no time for you, okay. He has so many letters to be, assessed. So why would he, think about it? He will just simply cross it down and move forward, and you will lose your score. So be very careful with the spellings and everything, okay. It is a costly exam. You can't afford to sit it down twice, thrice, or four times. Get it done in the first attempt and leave. Okay, and move to the next part. So be very careful with these ones. Okay, and decreased oxygen saturation. Okay, so either write decreased oxygen saturation or either write 80%. So just mention increased respiratory rate with oxygen saturation of 80%. Eventually, the reader will understand that 80% is a low saturation. You don't need to tell that 80% is a low saturation. So you just have to be very, very smart enough to manage your word count, okay, and everything in a very humble and polite way, and in a way that that would be more beneficial for you and for the one who is checking your letter. Okay, so that would be the better way to do it. Okay. Now let's move to the next part. Okay. Erythematous oropharynx on auscultation, he had bibasilar crackles and sonorous wheeze. So he was advised. See, yesterday I told you there is nothing like advise. Okay, and there is no so he was. So is very so kind of word. Okay, it's not a good word to write in your official or formal letters. Okay, so you can speak. You can't write so. That's very poor word to write it down. Okay, it is not a very good linking word as well. Just put a small full stop over here in front of the V's, and after that just write. Therefore, he was commenced or prescribed. Commenced would be much better. Okay, commenced on ampicillin, sulbactam, and supplemental oxygen. Okay, ampicillin for supplemental oxygen. Does that make sense? No. Okay, you can't say that I am prescribing you ampicillin for supplemental oxygen. So, is it like ampicillin? Is it an oxygen? It's not an oxygen. Ampicillin is a different medication. Okay, ampicillin and supplemental oxygen. That's it. There is no need to write suspecting this, suspecting that. Okay, it's completely a waste of word count because you have already mentioned all these things in your purpose. Okay, on this date, again, yesterday I told you it's not about lab. Okay, and it's not about his. We discussed it on the phone call as well, where I told you that whenever you're going to write or start the new paragraph, always start with the name of the patient. Okay, and this there is no like lab word. It's laboratory. Okay, laboratory. James's laboratory reports revealed, okay, pleural effusion and pneumonia, or you can say, and definitely, laboratory is something else, and radiological imaging is something else. So chest X-ray is not done in the laboratory. It's a different sort of thing. Okay, you have to be very very vigilant. I'm telling you all these things over and over again, and most of the things I'm repeating. And unfortunately, if you'll not get it done with it, okay, if you'll not understand my point, and if you think, and if there is problem going on, and if you're unable to get it, then there is going to be a lot of problem, because in writing, if you'll make these sort of mistakes, they are not going to forgive you at all. Okay. So again, so what you can write: on this date, James's X-ray or James's chest X-ray showed. Okay, and this is not the way to write chest X-ray. You have to write chest complete this way, and then write X-ray this way. Okay, this is not the word. Again, on this date, James's chest X-ray revealed pleural effusion and pneumonia, and his CT scan showed chronic sinusitis. That is the best way to write it down. Again, there is no so. Remove so from your vocabulary, and remove so from your life. Okay, but otherwise your life will be, and your exam will also be so. I don't want that. Okay. So treatment change to azithromycin. So this is very very casual language, and it's very very poor way of writing it down, because if you write this way, there is already a problem. Therefore is really a good word. Okay. Therefore his treatment was changed to azithromycin and ciprofloxacin. Okay, but it's not ciprofloxacin. Actually, before, if yeah, okay, so before it was sulbactam, and now it's azithromycin, ciprofloxacin. That's okay. And azithromycin is a generic name. It's not a brand name. So it is not a brand name. Then you will write small word. A should be small. Ciprofloxacin is also a generic name, so it should be small c. Okay, but whenever you're writing a brand name, then if you would have written Azithma, okay, or Zethro, for example, the Pakistani brands are from these names. So you can just write the capital word, but it's the smaller words should be in generic. Okay. Again, he should not be there. James had increased lung infection and frequency. So this is very bad way. This is actually a discharge plan. It's not a visit. So today, this is today. Today, James has showed satisfactory clinical recovery. Therefore, he is ready to be discharged. Okay. His discharge plan includes, okay, this, whatever was written next. Then you have to write a discussion regarding increased likelihood of lung infections, okay, and decrease uh, you know time in school, okay, has been made with him or his parents, whatever is mentioned in the letter. Okay. And then you have to write that his nutrition and physiotherapy include this. So all of these things are in the discharge plan. Unfortunately, if you have not written the discharge plan right, then everything is gone. So as I mentioned, this letter was referral plus discharge or transfer plus discharge. This sort of pattern you can write it down, then it should be a good letter. Otherwise, this is not a way to write it down. He is high school student, her mother. Come on, okay. So he is high school student and her mother. So this is already gone. So again, if you'll make this sort of mistakes, no one can save you. And I'm just being very, very blunt and honest about it. Because if you on this level, if you make these mistakes, then there's a problem. Okay, don't do this. Be very very careful, be very very vigilant while you're writing a letter. Don't take it for granted. Don't write your letter in a hurry. Okay, focus, okay, and think about it and then write. Okay, and then you will see the clear difference. So for this letter, I am going to write it down. This is not even a C plus letter, I would say, because the sharp plan is a big mess over here. This is a big mess. Purpose was okay. So It's not even but I'm being very kind. I will give you C plus, although it is not a C plus as well. Okay, or not even C plus, I would say C. Okay, so just get it done. Okay, this is not a good way to write it down. Thank you so much. I've read your conclusion as well, and let's just let's just get done with the conclusion as well, so that we see if there is anything remaining. Yeah. So this is your conclusion. He had been diagnosed with this and symptomatic focal epilepsy, for which he is on phenytoin, for which he takes phenytoin, Panadol, Pulmozine, and Cryon. In view of the above, I would be grateful if you could further assess and manage him. Yeah, that's okay. There should be no comma in your sincerely if you're writing, then that's wrong. Okay, so YOURS, that there is no comma, and after sincerely there should be a comma. Okay, and doctor. Okay, so that's your letter. Thank you so much. I'll see you tomorrow. Just whatever I have highlighted, just remember this, write next letter and do send it to me. Thank you so much.